Miss Martinez,
Yes, ma'am.
hi. I think I'm in a wrong Zoom. My schedule says Marvel, but inside of my announcement, I see your code. Oh, I see an old code for you that starts with the 8.
For Zoom,
Yes.
let me look. Ebony, you are on my roster for today.
Okay. So I'm in your class.
Yes,
Okay. Thank you.
you're welcome. All right, so welcome to community. I'm happy to see all of you. Hope everybody is having a good week so far. Um, so my name is Jennifer Martinez. I will be your instructor for the next 12 weeks as we go through community. I have been with Fortis since September of 2020. So 4.5 years, it'll be 5 years in September. I've been in nursing education for the last 15 years. I started with Fortis on ground. So I was at the Richmond campus for a little while. Then I was at the Norfolk campus. And then recently moved to San Antonio, Texas. So I am now with the online campus. So again, it's a pleasure to work with you. A little bit of background. I've been a nurse for 25 years. Primarily, long-term care and pediatrics are my two specialties, other than education. What else? I love peds. I love old people. Um, in some cases, especially when you're working with patients that have dementia, it can, be very similar dealing with kids versus some of our elderly folks. So not in difficult transition. Before I became a nurse, I joined the Navy. I was actually an air conditioning and refrigeration technician in the Navy. So got out of the Navy, then went back to nursing school. I had started nursing school right out of high school, didn't have a whole lot of funding, a lot of support. So hence I joined the Navy, just to get that little bit of support. I have four grown adult kids. Um, Two grandchildren, a 3-year-old granddaughter and a 1-year-old grandson, and another grandchild on the way, due in January. So I'm excited about that. I do have three German Shepherds. I will forewarn you that one of them likes to whine and she does know how to say mom. So if you hear somebody whiny, and sounding like they're saying mom, it is not a child that I am ignoring. It is a dog. I've actually had a couple confused students. Ernestine is trying to get in. I don't have her. Okay, so she must be still logging in. Okay, no worries. Um, but yes, I've had a couple students think that they have a child I was ignoring. I promise it is not. And Chili has one eye. Um, so she's very sensitive to sounds, so she gets a little nervous sometimes. Um, so I have both two daughters, two boys. My oldest is a department or a federal police officer. My two girls are both nurses. So my oldest daughter is an RN, my youngest daughter is an LPN, and I have a son who is a medical assistant. So they all went into healthcare except for the oldest. But I am originally from Brooklyn, New York. Um, Born and raised, moved to Virginia, to the Navy. And then, like I said, moved to San Antonio, Texas. Um, so if you've watched the news, it's just the way we live in hill country. So our area is a higher elevation. All the floods that you saw were literally around me. So it's just the way the terrain is. Um, we are like up in, I hate to say like the mountains, but it's kind of what it is. It's very hilly, and then there the areas that flooded, like the Guadalupe River and stuff that are around us, they were more like in a valley area. So it's actually kind of surrounded us. So today we are going to go through the orientation PowerPoint. So we'll do orientation to online learning. I know that you've been through online courses before. And then we will go through the syllabus, and then I will ask for some introductions from you guys. And so give us a chance to kind of get to know each other. And I will share my screen. Before we get started though, does anybody have any questions for me? Nope. All right. So we will get started. I'm going to share my screen. All right, so everybody should be able to see the PowerPoint. So again, welcome to community. Again, it's a pleasure to meet all of you and get to work with you over the next 12 weeks. So we talk about online learning. Make this a little bit bigger. So online learning, just like what we're doing here, it's using your computer and internet access to participate in an educational program. So, and you know, most of us, we get to be in our homes, right? Don't have to fight traffic to get to campus. A little bit more of a comfortable environment. I have interaction with you guys throughout the course, as well as your access to the online resources. I will be providing you guidance and leading activities. I may have to relocate. But I will provide guidance. I will lead learning activities, provide feedback to you guys about your progress as well. You will have weekly assignments that are homework. There's learning activities. 1 second. There are also quizzes and exams, as well as you will have your community HESI in week 11. You are responsible to complete the required coursework every week. And one of the great things too about the online environment here with Fortis is that you do get to meet students from other Fortis locations and interact with them. Has everybody, you can just shake your heads, raise your hand, however, has everybody looked at the course shell to kind of looked at the syllabus to kind of see what the requirements are for the course? All right, perfect. Perfect. All right. I made it too big now. It's not going to let me change my slides. All right. So again, my name is Jennifer Martinez. I'm going to be your online instructor for the community course for the next 12 weeks. I will be your first point of contact. All right, if you have any issues with your homework, if you're having issues with your computer, if you're having issues logging in, anything like that, any issues outside that is going to affect you from being successful in this course, please let me know so we can try to be proactive so that we can ensure your success. I am available by email through Canvas as well as by phone. My phone number is on the syllabus cover sheet that is in your announcements. You may call, you may text, however you feel comfortable, as well as email, of course. If there is something, again, that is going to hinder you from being successful, or if an issue arrives, please reach out to me. So again, we can try to, circumvent and try to avoid you missing any pertinent material, as well as quizzes and exams, things like that. I am here to help you improve your performance if you are having issues, if you're not understanding a concept, if there's things that you need a little bit more assistance with. Please feel free to reach out to me. I am here for you. I will be providing feedback through grades in your assignments as well. You will have feedback, written feedback for all of your assignments. So please be sure that when grades go in, that you look at the comments that I make on your assignments. My comments are there to, again, help you improve, help you to continue your success, offer some guidance. Again, the goal is for you to complete your next, and some of you are in your last term, others are in your second to last term, right? So we want to get you through your courses, be successful so you can graduate. I am experienced in the course content area, so have worked with community-based nursing before. And then remember, this is a professional setting. So when we communicate with each other, please ensure that we are respectful. It is okay to have difference of opinions. It is okay to have different views. Just be mindful as we are sharing those that we are respecting everybody within the course. So your course contact information, again, you can find my information in the about your instructor section on your Canvas shell, or you can find the syllabus cover sheet that I posted in the announcements has all of my contact information on there. So I will be your first point of contact. The course lead for this course is Dr. Annalena Lundy. Her email and her phone number are listed there for you. If it is something that I cannot assist you with, or we need additional guidance, we can go to Dr. Lundy. And then Dr. Brown, she is the National Dean of Online Nursing Education. Her contact information is there as well on the side, her email, as well as her telephone number. If you do have any concerns, as far as your campus courses, sim, lab, clinical, or any of your campus ground courses, your campus instructor is going to be first. Then, of course, if there's a course lead, as then your campus dean. Everybody knows who their campus contacts are, correct? Okay, great. All right, so when we talk about communication, um, again, state your thoughts, be courteous, be positive, be respectful, be very mindful of how you express humorous or emotional statements, because in some cases those can be misinterpreted. You want to keep your comments relevant to the discussion topic. Again, it is okay to have, everybody has their own thoughts, they have their own perspective on things. There is absolutely nothing wrong with that. And I'm happy, please share your thoughts and your opinions. Just be considerate of others when we do that. Make sure we are using proper language, titles, do not use slang. And then when you are typing your messages, whether it's in a discussion or another message, just don't use all caps. That does give the impression that you are yelling, right? And that could, somebody could take offense to that. So just be mindful of that. Your online course has specific start and end times. So I did get a couple emails that there was some confusion about today's class. So we are meeting on Wednesdays. Class starts at 4. It ends at 5:40. So every Wednesday from 4 to 5:40, we will meet. These are mandatory sessions. So just like your on-ground courses, you are required to log into Zoom and be present during the whole course. Course activities can include discussion questions, which we'll go over the syllabus after this orientation PowerPoint. But you'll have discussion questions, projects, papers. There may be case studies, quizzes, or exams, of course, are going to be present. Your discussion boards initial posts are due by Wednesday. And then you need to have 2 peer responses by Sunday. Due dates are according to the syllabus week and posted in your course shells. So all of your assignments already have, excuse me, due dates assigned to them. So you should be able to see those. When we talk about academic integrity, so standards of student professional conduct. Academic integrity is extremely important, and I know that you guys know that. All noted incidences of academic dishonesty and violations of academic integrity will be disciplined. So some of the things that we are talking about when we talk about academic integrity or incidences of academic dishonesty, cheating is one. Plagiarism, that is the submission of the work of another person for credit or failure to properly cite references for any work which is not original to the student. It's copying the work of others or allowing another student to copy from the student. It is also the unauthorized use of notes or materials in exams, including talking to other students. It is forging or altering assignments. It is unpermitted collaboration, giving or receiving aid on a take-home exam or other academic assignment under circumstances in which a reasonable person should have known that such aid was not permitted. Allowing others to copy or use work that is not theirs, or providing answers from graded assignments to others. Now, it mentions take-home exams. We do not have any take-home exams in this course. Has anybody ever taken a take-home exam? No. I will tell you, honestly, take-home exams are worse than regular exams. I had one, our psychology instructor way back when was in my associate's degree program gave us a take-home exam. And it was only 50 questions, but it took me like 5 hours to do this take-home exam. It was horrible. And like, I would rather take a pen and paper exam any day of the week after that. The American Nurses Association Code of Ethics for Nurses. The Code of Ethics serves the following purpose. It is a succinct statement of ethical values, obligations, duties, and professional ideals of nurses individually and collectively. It is the profession's non-negotiable ethical standard. It is an expression of nursing's own understanding of its commitment to society. Oops. Sites that promote cheating. So use of those sites does not promote honor, ethics, or integrity. Fortis is monitoring those sites. So if you are found on those sites, it does place you on heightened monitoring of your work for academic integrity violations. Referencing these sites or submitting work found on these sites will result in a 0 for the assignment, which in some cases that may be enough to cause you to fail the course. If there is a second incident, then that will result in a course failure. Utilizing these sites, whether you're posting and downloading, that puts you at risk of being dismissed from the program. So your campus as well as upper administration will be involved. If they are not on your list of student resources in your course shell, don't use them. That's the best way to do it. So some of these sites are like Sudoku, I don't know how to say it. Course Hero, Stuvia, Quizlet, those types of sites. You don't want to be, don't make an account, don't upload, don't download any of the information on those sites, just to keep yourself safe. The late work policy, submit your work on time. That's going to be the best bet for you. Late work is only accepted with prior approval from your instructor. So you have to let me know if you are going to submit something late, whether it's, um, if there was something that, personal issue, family issue, internet issue, whatever the issue is, if you are going to submit an assignment late, you need to let me know that you are going to be submitting it late, and the reason for the late submission. With the late submission, it's still going to follow the late policy. So if it is submitted anywhere between 1 and 7 days late, that will receive a 10% deduction in the grade. If it is 8 or more days late, that will result in a 0 for an assignment. Again, we understand emergencies happen, and this is why I just say open communication is very important, because I can work with you if I know what's going on beforehand rather than afterwards. Attendance. So attendance will only be recorded during your assigned live session time. So again, Wednesdays, 4 p.m. to 5:40 p.m. If you're here and you're logged in, you will get attendance. I took attendance as you guys were logging in during the session. To be counted as present in the class, students must sign in with your full names. So everybody has their names on their screens. I appreciate that. Be on camera the whole time. So camera needs to be on your face, not the ceiling, not your keyboard, not the ground, right? I want to see all of your lovely faces. Anyone at work or driving will be removed from the session. So please don't be in your car, don't be at work while you're trying to attend class. If you go off camera, and again, sometimes we have to go use the restroom, right? Send me an IM, hey, I'll be right back. If you go off camera and I don't know, and I ask you to come back off camera and you don't, then I will remove you from the session. I can verify everybody's time in the class. Zoom does keep a log of all the logins. So I can see your login, I can see if you log out and then come back in, so that I can, properly post your attendance. Attendance missed is going to be recorded in 15-minute increments. So if you're 5 minutes late, you're going to get deducted 15 minutes. If you leave 5 minutes early, okay, then you are going to get deducted 15 minutes. Okay, so it's going to be in 15-minute increments. Anyone without posting attendance 14 days in a row will be dropped without notification. You guys have been in the program for a while now, so you guys should understand the attendance policy. There is no makeup for missed attendance. If you miss class, can't make up the time that you missed, the resources will still be available to you. So of course you can still watch the recordings. You can reach out to myself to make, to go over any missed content that you may have missed during that class. Again, attendance is taken daily by the instructor and turned over to the registrar before the end of class every day. So as soon as our time is up, I will post attendance and it will be in there. Any early departures, tardies, class cuts will be recorded in 15-minute increments. Attendance records are maintained by the registrar as part of your student or your permanent academic record. So students with chronic absenteeism in excess of 20% of the scheduled hours for a course may receive a failing or reduced grade for the course. So with that, students missing more than 20% of the scheduled time will receive a full letter grade deduction at the end of the term. So try not to miss class, even coming in late or leaving early. Those minutes add up quickly, so be very mindful about your time so that you can avoid that grade deduction. A student who is at 5% time absent will receive an email through Campus View notifying them. At 10%, they will be required to meet with me, which who's the online dean, my apologies, as well as the campus administration. And then the level of intervention will be reliant upon the amount of time missed, and a student may not receive all levels of warning prior to missing the 20%. So just know, even though they usually are really good about sending out the attendance letters, you may not get one. Best thing to do is just try to make it to class every week. So your seven key steps to success. So step 1, review work that is due each week. Go into your modules and it gives you a weekly overview. It'll tell you what the topics are for the week. Your modules also will provide you with any assignments that are due during that week as well. Complete the reading assignments each week. So as we go through the syllabi, you can see that for community, your reading assignments are scattered throughout different textbooks. Some are going to be your med-surg, your foundations, and then there's also going to be readings that are actually posted in your Canvas shell. It's not whole chapters. In most cases, it's just parts of chapters. Some cases it is the whole chapter, but you want to look at the readings that are, there each week, and preferably before class so that we can discuss the topics. Complete your lessons each week, whether it's case study, whether it's your NCLEX questions, your discussion questions, your papers. Make sure that those are all, done as well. Attend your live sessions. Okay, again, remember the live sessions are mandatory. Step 5, and this was a big one. Carefully read the directions and rubrics to all assignments before starting them. The assignment directions, the rubrics are there to guide you in doing your assignments. All right, and the rubric is going to break down the assignment for you and tell you how much or how many points each section is worth. And then all of the pertinent information that should be included. The rubric also helps in the design of your paper, so you can, outline your paper according to the rubric. This also will help you, to make sure that you are getting all the information that is supposed to be covered within that particular area. So your rubrics are very important. Complete all assignments, papers, NCLEX questions, your discussion questions, CJ Sims, whatever the assignment is, on time is the best way to do it to avoid any late penalties. Additionally, by doing those assignments, it does help to solidify those concepts for the week. And then step 7, study and, come in prepared to take your quizzes and your exam. So raise your hand if you've attended live review for your exams in the past. All right, awesome. Okay, those live reviews are there to assist you to be successful in your tests and quizzes. If I don't know if anybody has noticed, but I did put the dates or the times for your live reviews on your schedule in Canvas. All right, so they should pop up for you as a reminder. The Zoom link is attached to it as well, so that you can attend those live sessions. All right, other things, logging into class 4 to 5 times a week to stay connected and stay engaged. Review your course announcements at least weekly. Your announcements will go in either on Saturday afternoons or Sunday mornings. There will be announcements every week. Definitely on either one of those 2 days. There may be more, just depends on what's going on. So make sure that you are reviewing the course announcements. If you have any questions about anything that is going on, please email me, text me, call me. Submit all assignments on the week that they are due. That is includes your discussion questions. Again, your discussion questions are the first initial post is due by Wednesday. Then you need to have your 2 replies to your classmates by Sunday. And then towards the end of the week before the Sunday deadline, go back in and review the assignments, make sure everything was submitted, and then you can also review the assignments that are due for the following week. Anybody a procrastinator? Anybody? There's a couple people that'll admit to it. I am the world's worst procrastinator. When I was in school, I always put myself into stressful situations. Um, where it was Sunday and I was having to write a paper or, up till 2 o'clock in the morning getting my paper written and submitted. It's not always a good feeling. I always started off with the best of intentions. Every new class that I took, I was like, I'm going to be on top of it and be proactive. I'm going to do my assignments early. And then I would fall into the same old trap. So depending on your level of procrastination, I started using my cell phone. I would set reminders in my phone. I started to schedule time during the week, even if it was just an hour or two here and there, in order to make sure that when it came down to the deadline, that I wasn't, at least would have something started rather than having to start from scratch. So there's, time management skills are really important. Again, want you to be successful in this course. So I'm here to help you. But I also, like I said, I'll send those announcements out every week. You'll know exactly what is due, when it is due. Best advice I can give is try not to procrastinate, just so you don't set yourself up for being late with anything. Keep in contact with me, please. Again, I want you to be successful in this course. You guys are almost done with your programs. So if there is an issue that is happening, that potential issue that is may cause you to be unsuccessful in submitting an assignment, issues with tasks, quizzes, that kind of thing, feel free to reach out to me. And so, maybe we can be we can be proactive rather than reactive. If I know that there's a situation that is going on, I can help you if I know about it beforehand, not after. I've had situations and I've had students in the past that have had unfortunate situations, did not want to share. I don't need to know the whole life story, just a little bit about what's going on to try to help you, but have come in and taken tasks and taken quizzes and have not done so well. And then after the fact have said, I didn't do well because this happened before. And so again, I can't help you after the fact. I can only help you before. So keep in contact. Make sure that your internet connection is reliable, your computer, your laptop, whatever it is that you are using. I hope everybody has a nice quiet place that's free from distractions so that they can complete their assignments. And then again, read all your assignment directions carefully. That is key. Reading those assignment directions and using those rubrics are super important. So day one of the term, which was, I guess, Sunday or Monday, log into Canvas. You should have looked through your online course, gotten my information from the course or from the instructor information. Again, look, have my contact information available, put it in your phone, wherever it is that, keep it handy in case something does happen. Print or save the course syllabus to your computer, so that you have easy access to that. That's another way I have also seen students help to stay organized, especially for those visual people. I've had students that have printed out the syllabus and then color coded each week, so that they, kind of help to stay on track with that. Make sure that we're going to go through the syllabus again, but make sure you've reviewed it, the outline. Make sure that you have the correct textbook and edition. So most of you either, I'm not sure at what point, I don't remember when we switched over. Some people have ebooks, some have hard copy textbooks, it really just depends. But make sure that we are all using the same, that you have the correct and updated editions. If you have any questions, if you're missing anything, please let me know so we can get that corrected. Other things, come prepared to discuss the concepts. Reading the information and looking at the information prior to coming to class is going to, it's going to help you. You can come with questions as we're going through the material for class. If there's something that you don't understand that that was in the reading, I can provide clarification for that. My office hours are Wednesdays from 3 p.m. to 4 p.m. And you can use the same Zoom link for class as for my office hours. If there's something else you need, then you are not able to meet during my office hours, send me an email, send me a text, call me, and we can set up another day and time that is, suitable for both of us, whether it's extra tutoring, help with certain topics, whatever it is, reach out to me and we can schedule those outside of my normal office hours. If you have any technical difficulties, you can always reach out to technical support as well. Other learning activities. So office hours, we can review information that was, within that course. Some weeks there are going to be supplemental lectures that were prepared by some other community instructors that will be posted in the announcements. So make sure that you look at those too. Those are going to be beneficial to you. The lectures from each class additionally will be posted in the announcements, so that if you need to refer back to a lecture, you have that ability to do that as well. The live exam reviews, the live HESI review will also be recorded and posted within the announcements. So again, it's all here for you, to help you guys be successful. Attendance is taken at the review sessions. Again, they're not mandatory. They are highly recommended. All right. Because we have seen some great success with students attending those live sessions. There is, like I said, there's 101 tutoring that is available. Reach out to me if my office hours do not work for you, and we will set up a different time a different day. I know. All right. So your grading component. So this is just an example. of how the grades are broken down. Um, so your KGAs, which are your key graded assessments or assignments, are your exams, your specialty exam, and your quizzes. All right, so those are your KGAs. Your NCLEX questions, your vulnerable populations assignments, your HESI prep assignment, case studies, discussions, all of those are homework assignments. They are not averaged into your KGA. You have to have a 78% KGA at the end of the term for quizzes, exams, and your HESI. Once that 78% is met, then your homework grade will be added in. So homework can make or break you. So it is really important that you turn in your homework as well. Weeks 1 through 5, the homework scores will be turned off. So the only grade that you will see at that time is going to be your KGAs, which is your quizzes, your exams. Week 6, we will turn the homework grades on. So that will show you what your overall KGA would be. So if you're missing any homework, you can see how that will affect your key graded assignment or your KGA scores. Week 8 will then turn the homework scores back off. That you can see your KGA again. And then the homework scores will stay off until HESI remediation is complete. And then the homework scores will be added back in. So HESIs are in week 11. The HESI remediation is due by, is it Tuesday at midnight? And then once remediation is done, then I will turn the homework grades back on. So again, your combined score on quizzes, exams, and specialty must be a 78% or above before any credit for completed homework is given. A minimum passing grade of 78%, which is a C+, is required for successful completion of the course after the homework scores are added in. So again, homework scores are super important, especially, if you don't do a couple assignments, that can definitely drop. If you're, if you have, if you're sitting at a 78, right at 78, you miss a couple homework assignments, that's going to drop your 78 below. So be mindful of that. All right, for exams and quizzes, you have to have 2 devices for each quiz and exam. So you have your laptop that will run your exam, and then you can use a phone to be on Zoom. Make sure that they are both either fully charged or on the charger. If you go off camera while in the exam, you will receive a 0 for the exam. So make sure that your camera or your devices are charged, that your camera stays on. Quizzes are part of your KGA, and will be completed in class. So you'll take your quizzes with me in class. They are designed to be given at the beginning of a class. So we will, take them once everybody logs into class, we'll take our quiz. There is only 1 attempt on the quiz. You have 10 questions on your quizzes. You'll have 15 minutes for each quiz. Make sure that you submit it when you are complete. If you take a quiz off camera and you're not proctored, you will receive a 0 for that quiz. Quizzes cannot be made up for any reason. So be mindful of that. If you are going to miss a quiz or a class and there's a quiz, then you're not there to take the quiz. You will receive a 0 for that quiz. Exams will be scheduled and given through ExamSoft. I'm sure everybody already has ExamSoft. You will have to have that second device to log into Zoom. And then, however it is you sign into ExamSoft, you want to make sure that you read the exam description carefully so you know the requirements. And then once everybody is logged in and we have checked everybody in, then we will start the exam. When you are done, make sure that you click on save and upload. And then you should get that nice little green check mark, right? That shows that it has been uploaded. And then once you submit your exam, you should see that green check mark, that confirmation screen, and then you'll log out of the testing site. You are only allowed one attempt at the exam. You cannot stop, pause, and then resume. If you are having any technical difficulties, stop the exam and let me know. These exams are timed, so please pay attention to that as well, so that you don't run out of time. Anyone with accommodations, not asking in a group setting at all. But if there is anyone in here that has any accommodations, you do need to notify me as soon as possible. And you can do that via email. Um, if you had, just because you had accommodations last term doesn't mean we know. So you had different instructors last term, and it is going to be your responsibility to let us know, so that we can make sure that everything is set up appropriately for you. Notifications less than 10 days before an exam may not be able to be granted in time. Okay, there is a process for this. So if you have any accommodations, please let me know so we can, make sure that you are set up for success. Exams are going to be held during the scheduled class time. All right, so exams are going to be at 4 p.m. on Wednesday. So you will take your exam during the class time. Um, the exceptions are only with written approval by your faculty and copied to the National Online Dean. Again, if there is a reason why you cannot take an exam, if something happens, you need to notify me as soon as possible, so we can also go to the online dean and see what we can do. Not taking an exam during a scheduled class time will result in an absent not taking an exam during a scheduled class time will result in an absence, right? Because you can't make up that lecture time. Exams can only be proctored with a faculty member on campus with 72-hour notice and must be done during the scheduled class time. So if there's anybody that has been or prefers to take their tests on campus with the faculty member on campus, also need 72-hour notice for that so that we can make sure that everything is set up appropriately. Exams are Zoom proctored, so you must be on camera the entire time. You must show your ID. You're going to do a 360 view of your testing environment. So your desktop, your walls, your sides of the computer, chair, floor. If your ears are covered, then you will need to show your ears. You can't have any earbuds, eye watches, any of that stuff on. No paper is allowed. So if you are somebody that likes to use a pen and paper or for your math or whatever, no paper is allowed. So whether you have a whiteboard and a dry erase marker, or you can use a sheet protector and a dry erase marker, that would be, those work too. You cannot use a personal calculator, so you have to use the one that is in ExamSoft. If a tester has any religious exemptions, please discuss that with me. Appropriate accommodations, of course, are going to be granted. And then do not assume instructors know individual requirements. So again, if you have any accommodations or anything like that, please reach out to me, so that we can make sure that we have everything in place that we need to have in place. Missed exams will be held to the late work policy. So again, this is where communication is key. If you missed an exam, and you did not let me know, then you will receive a 0 for that exam. If it's a personal reason, and you notified me, then there you can take the exam. Um, I'm sorry. And then if it is due to an emergency, then you will have to supply, um, documentation of the emergency to the National Dean of Online Education within 24 hours of the exam. And it must be presented prior to the exam being rescheduled. Any exam not scheduled within 7 days of the class time will result in a 0. So just kind of keep that in mind. We understand that emergencies happen. That's why communication is key. All right, taking exams and quizzes. So nursing exam as well as your quizzes are all timed. Give me 1 second. Team places. Um, You can only complete them once. Once you start an exam, once you start a quiz, you're going to complete it. There's not another attempt. The instructions are going to be there in Canvas. So you can see what the instructors for or the instructions for each quiz and exam is. If you have any technical issues during a quiz or an exam, do not continue or try to continue if you are having technical issues. Notify me immediately. We can verify issues looking at your log in Canvas. We can, that tells us how many times you stopped viewing the page, how much time the students used of the allotted time, how many questions were seen. And then if if there's something we can do, we can give you a code to re-access the quiz. We will not allow a retake of an exam due to technical problems or other physical or emotional issues when the majority of all questions have been answered by the student or time has run out. All right, so just be mindful of that as well. With your specialty exams, the specialty exams are your HESIs. Those are given in a proctored environment, which is usually on campus. There is only one attempt for your community HESI. There you will have an assigned date and time for your exam, and that is usually set up by your campus, somewhere during week 11. The exam counts for 20% of your testing grade, and then the benchmark is always going to be 900. Remediation is mandatory. So you complete your HESI exam, you look at what your HESI score was, and then you complete the required remediation, right? One thing that I will tell you, please, 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 pay attention. I know a lot of people, they get 900s. I have seen some outstanding HESI scores, people getting conversions of 99.99. Yes, there is still that 1 hour of remediation that is required. Please don't forget. I know you do really well on your HESI. There is still 1 hour of remediation required. So please don't forget, they are submitted by 1 a.m. Monday of week 12. All right, so make sure that you get your remediation done. If you don't do 100% of remediation, then you will get a 0. So imagine you get a 99.9 conversion score on your HESI, you don't do that 1 hour remediation, now you just received a 0. So please make sure that you do your remediation. I will send out reminders during HESI week about remediation. If I start, if I see that some haven't started over the weekend, I'm going to start sending emails as well. Just a reminder, get that remediation done. For your exams, you must show your ID, which is your school badge. Again, you must be on camera at all times. Your full face must be visible. Any failure to show your photo ID or not being fully visible may result in exam or course failure. So if you have any problems, you need any extra help, please feel free to reach out to me. Homework assignments. Again, this comes back to not procrastinating, making sure that you are planning your time appropriately. Read your syllabi, right? What do you need to have in order to, complete that homework assignment, fulfill that task, schedule it on your calendar, try to get as organized as possible with your due dates so that you don't miss anything. Complete all your readings, make sure that you follow instructions, and then title your assignments appropriately according to how they should be titled. So this is just kind of an example. You can use the course calendar in Canvas. It's actually pretty user friendly. You can add things in there in order to help keep you on track. If you're a more paper person, right, you can use planners, journals, that kind of thing as well to try to keep yourself organized. Again, late work is not going to be accepted without prior approval from your instructor. So if you don't turn something in, or if you're not going to be able to turn something in, you need to let me know ahead of time, not after. Oops. Sorry, there's a message. There we go. Okay. Late submissions, 1 to 7 days is going to be a 10% reduction. 8 or more days is going to be a 0. Again, late work will not be accepted without prior written approval from your instructor. So if you have to let me know if you are going to be late with an assignment. The purpose of the NCLEX practice exams is to prepare you to sit for your NCLEX, and they are in every one of your nursing courses. So look, your NCLEX questions, they're the directions, and we're going to go through this when we get to the syllabus, but you're going to go in, you're going to select the appropriate question, the appropriate topics for each week's NCLEX questions. Submissions must be the number of questions required on a single submission, whether you have to do 50 questions or 25 questions. We're only going to take one submission. Once submitted, the score you submit will be the score you receive. One thing about NCLEX questions is you have control over this. All right, if it's a 50 question requirement and you turn in a score of 38, that is your score of 38, right? You don't have to turn in the first one. You can repeat them. You can do them as often or as many as you need in order to get the highest score possible. All right, so keep that in mind when you're turning in your NCLEX questions. You have complete control over that. Make sure that you are downloading it appropriately. Everybody know how to download their NCLEX question report to submit? Yes, all right, perfect. Talked about that. And then you're having your practice exams. Practice exams must be accessed through the Canvas course module. You can't access them through your Evolve account, so you need to make sure that you are accessing them through your course module. Grades for the practice exams, those are automatically transferred into the Canvas shell. And so again, when you click on your Canvas shell, you go into the practice exam or the practice quiz. Once you are completed, it will automatically push into Canvas. So don't really have to do anything, you don't have to, submit and assign, a PDF or anything like that. If you don't access it through the Canvas shell, then you will get a 0. Um, if you are repeating the course, you will need to let me know as well so we can get that reset for you. You guys know what CJ Sims are. Those are your patient care scenarios. Um, those are not to be completed until they are assigned. And then of course your submissions must be a screenable screenshot. So it has to have your name, the name of the patient, the date of the assignment, as well as the score for the scenario. And then the paper assignments are there to guide the development of personal goals that are relative to the profession. Talked about the assignments, talked about your rubrics, and we're going to go through other tips for papers and discussion questions. APA. If you do not know how to do APA formatting, please review. You can do the Learn resources for Purdue OWL. There's other examples that are out there as well. Use nursing journals or appropriate .orgs, .edus. Stay away from things like Sudoku and Course Hero, like we talked about earlier, because that could be an academic integrity violation. Make sure that your references are no more than 5 years old. That's going to denote best current practice. If it's older than 5 years old, then it may be outdated practice. Unless, of course, you're going to quote somebody like, Florence Nightingale, who hasn't been around in the last 5 years. Okay, that might be a little bit older, but when we're looking at current best practices, you want to stay within that 5-year time frame. Use, summarize, paraphrase, and then of course make sure that you're doing in-text citations as well as references. Try to avoid quotations. 1 or 2 here and there aren't, too bad. But you don't want to have just a whole bunch of quotations in your paper. You want to try to make it your own as much as possible. And then some other just things to think about as we go through the term. Are you prepared for your specialty exam? What remediation could I review with you to help you prepare? What concepts covered in your homework assignments did you find challenging or difficult to understand? You want to be prepared to discuss how care is continued once the patient is discharged from the acute care facility. How can a nurse maintain professionalism if they are not part of a hospital-based system? Do the requirements for a nurse change based on the surroundings they work in? And what is a nurse's accountability, whether they are on or off duty? And so, there is accountability. And once you get licensed, there are certain behaviors and things that are not acceptable when you if you get in trouble outside of work, that can still affect your license and affect your work. So, any questions? Nope. I am going to give everybody a quick break. So be back at 5:15, and then we're going to run through the syllabus and do some introductions. All right, so let's go through the syllabus real quick and then we'll do our introductions. So let me share. So at the top of your syllabus, you have your course description. Your pre-reqs, your total contact hours, so it's 20 hours of lecture, about 3.5 hours per week outside of lectures, which is about 44 hours for the term. You have your student learning outcomes, your course objectives, our instructional materials, and these are going to be your required learning resources for the term. So your fundamentals, concepts, and skills for nursing, which is your 6th edition, your Med-Surg Nursing 5th edition, your Intro to Maternity and Pediatric Nursing 9th edition, and of course, CJ Sims. So make sure that you have access to all of those appropriate textbooks, okay, because that's what you're going to need in order to, as we go through this course. You have your reference package as well, and those are those, the ton of books that you got, your Calculate with Confidence, your skills, your Saunders, all of that wonderful stuff. That we talked about the nursing attendance and absenteeism and all that stuff. Here's your breakdown of your KGAs, right? We're going to have 3 unit exams, which are going to be 55% of your grade. You have your HESI specialty exam, which is 20%. There will be 5 quizzes, which is 5%. So again, unit exams, HESI and quizzes, that is going to be your KGA. Then you have your Saunders questions. There's a total of 200 questions, which is 5% of your homework grade. You'll have a vulnerable populations project, which is 5% of your grade. Your HESI prep assignment, which is 5% of the grade, and then your case studies, which is an additional 5% of your grade. All right, so pay attention to these as you go through, that you don't miss any of your homework assignments. And I'll go over the HESI prep assignment in just a few minutes. And so here again, we'll go through week 1 just so you can kind of see what I was talking about. So for readings for week 1, it's chapter 1 in your fundamentals book, which is nursing in the healthcare system, community care in your Med-Surg textbook, which is on page 123. Your Healthy People website. This is going to be a very valuable website for you throughout this course. All right, so make sure you go to health.gov and look at Healthy People 2030. And then there's going to be your discussion question this week. And then you want to go through, there's some readings in your Canvas shell regarding levels of prevention, Healthy People 2030, as well as an introduction to vulnerability. Those are going to be the topics for your quiz 1, which is going to be next week. All right, so make sure that you go through all those readings and reach out if you have any questions about those. I'm going to stop sharing for just a second, and I'm going to go into your Canvas shell. And I am going to pull up your HESI prep assignment. All right, let me share my screen again. All right, so your HESI prep assignment, all right, it is open. And so I suggest you open it now and you start looking at this. Okay, the document is here for you to download. And this is what your HESI prep assignment looks like. All right, so put your name, you'll put the date that you submit it on. And so as you complete, use your AdPi process. All right, so assessment, diagnosis, plan, interventions, and evaluations. You can literally write AdPi and then put the guidelines next to it. It is a very detailed assignment, so that's why I suggest you open it and you start working on it now. So the topics will bioterrorism, your disaster topics, epidemiology, then health promotion and teaching. And then Your home health topics are at the towards the end, your infectious diseases, and then your vulnerable populations. All right, so this is a working document. It is best that you open it now, and you start working on this. This is obviously, I forget what the due date was. Let me close. So your due date for this is going to be on September 8th with September 15th. So my suggestion is that you open that up, you have it, and you start working on it, because it is a pretty long assignment. And total points for the assignment is 100%. So you want to make sure you maximize your points with that. The other project you have is going to be your vulnerable populations project. Your vulnerable populations project is going to be due in week 10. And we will talk more about that vulnerable populations when we get into week 3. So that will open up, but those are going to be your two big projects. There's also an infectious disease group project that is going to be due in week 7. I will be setting up groups for that. As well as assigning a topic for your infectious disease process. All right, so you will get that information prior to as well. So you'll get your groups, like who's in your group, as well as your topic. All right, any questions about anything within the course thus far? Everybody's okay?
I noticed we have a quiz, I think, the first quiz next week.
Yes, ma'am.
So my question is, it's specifically related to the content we read this week.
Correct. So, yep, so when you go into your course cell and you look at your week 1 overview, and the second one, which is your week 1 reading, you want to go through that. And then there is another one that says Introduction to Community Nursing. So it'll talk about like community health nursing, what the roles and responsibilities are, what the duties are. And so you want to make sure, yeah, you do the readings that are there for that are listed in there. And there's also, other references in there. Just stick to your readings for right now if you have time to look at some of the other references. But I will tell you that Healthy People 2030 is going to be a really good reference for you as well. So make sure you go and visit that website. Another thing too that I want to just throw out there, if there's anybody that is repeating this course or is a re-entry, please send me an email with some days and times that you are available, so that we can go ahead and get weekly meetings set up, just to make sure that you are successful. We want to try to make you successful with this course moving forward.
For the nurse process project, is it okay to have it typed or do we have to have it written?
Are you talking about the HESI prep
The
assignment?
HESI prep,
You
yes.
can type it right into the template.
Okay,
Yep. You can type it right into the template and then just submit the template. It's perfectly fine. It's
got
probably easy
it.
to do it that way unless you really like to do Word or something like that. However, but yeah, you can type it right into that.
Also, I know you asked us for the last class for leadership as far as the Kaplan Live.
Mhm.
Since some of us have you as well for this class, I don't know if you got to note that and like if we're making arrangements for a makeup class or not.
So there won't be a makeup class, but you will be allowed, if you miss a class, whatever quiz is, assignments or do that, you will have that. You will be able to submit those. But I do have your date. Thank you for reminding them. Yep, I do have your dates already written down. So yes, no worries there. All right, any other questions? No. All right, so I told you about me. If there's anything else you want to know about me, feel free to ask. But we're just gonna, if you don't mind, at a minimum, name what campus you're from. And then of course, anything else that you would like to share, that is fine as well. So do I have volunteers or do you want me to just go down the list? All right, Cecily, go ahead.
My name is Cecily Wims. I'm from Richmond campus, and I want to be a psych nurse. And I'm at the second to last. Okay.
All right. You want to be a psych nurse? Awesome. Okay.
Yes.
All right. Thank you. Who wants to go next? All right, I'm just gonna go down the list then. Miss Banks, Queen, introduce yourself for me.
Hi, my name is Queen Banks. I'm at the Sprint and Fortis campus. What are we supposed to say about ourselves?
Whatever you want to share is fine.
I don't know.
Okay, that's fine. Well, thank you. It's a pleasure meeting you. Look
Same.
forward to working with you.
Same, thank you.
Thanks. Sahara.
I'm Sahara. I go to the Scranton campus.
All right.
I also have 2 German Shepherds.
They're loud.
Yeah.
Okay, so Miss Clark, since I do not know how to say your first name, I am going to let you introduce yourself.
Hello, my name is Tevier. I know the H at the end kind of makes it difficult, but I go by Tevi if you can't pronounce it to make it easier for you.
Okay.
And what am I supposed to be saying? I'm sorry, I'm exhausted.
It's okay. What campus are you at?
Oh, I'm at Fortis in Cincinnati, Ohio.
Cincinnati. Okay. Cincinnati. All right. Miss Naomi.
All right, I'm Naomi, and I'm at the Essington campus in Pennsylvania.
Okay. How far is Scranton and Essington? Are they far apart?
I don't know.
No, because Essington's more down Philly, so about a few and a half hours.
Oh, wow. Okay. Okay. Miriam. She was here, did she not? She's not here anymore. Okay. Is it Sidra?
Yes.
Awesome.
Sidra, I'm from the Essington campus.
All right. Karima.
No, Karima Jones from Essington campus for this.
All right. Vanessa.
Vanessa Lewis from the Essington campus as well.
All right. A lot of Essington. All right, Ebony.
Hi, I'm Ebony from Cincinnati, Ohio campus, and I plan on going into nutrition with my nursing.
Okay. So like, do you want to do like a registered dietitian or like
Registered dietitian.
Okay.
Yeah.
Awesome. Kaylee.
My name is Kaylee. I'm also from the Essington campus in Pennsylvania. And I'm kind of just sitting here really trying to figure out what exactly I'm supposed to focus on to like prepare myself for a test or a quiz, or is it just generally just keep rereading everything? Because I'm having a hard time with like the concept of this class just seems to just be everything.
Okay, well, we'll go over that. What campus are you from, Kaylee?
Essington, Pennsylvania.
All right. Hey, Ashley.
I'm Ashley, and I'm from the Centerville campus.
All right. And then Miss Thompson, I do not want to mess up your name.
It's Oris, and I'm from the
No.
Essendon campus as well.
Essington.
Mhm.
Oris. Oris. All right. And then is it Tamaya?
Tamia,
Tamia. Okay.
and I'm from the Essington campus.
All right. All right. So thank you all again. It's a pleasure to meet everybody. I look forward to working with you this term, going through community. So when we look at community nursing, okay, community nursing kind of is all encompassing. Okay, there's a lot of med surg topics that are going to be part of this course as well. And we're going to talk about a bunch of different things. I mean, we're going to talk about occupational health nursing, community nursing, home health nursing, parish nursing. The thing that's different with community is right now when you're in your clinicals or when you're talking, in med surg and things like that, your focus is on one patient, right? You're focusing on one patient with one, whatever, how many disease processes they have going on, right? With community, we are looking at a group of people. Okay, so that's where your difference is going to be. It's not just an individual patient. We're going to look at the community as a whole. So whether it's like looking at outbreaks of disease, disasters, how do you better help vulnerable populations? And what I mean by vulnerable populations are populations that are particularly at risk for disease, for violence, for trying to think of other the ones that are at risk. So for example, when we look at risk, think just looking around in your communities, homeless population, right? We know homeless population are at risk for a variety of things, whether it's weather exposure, not they don't have access to food, shelter, right? Teenage pregnancy, or your teenage moms, they are another at risk. Your migrant workers, your immigrants, your veterans. So there's we're looking at these populations or these groups of people as a whole versus individually. So that's kind of what community is about. So that's one of the big differences. And so it is a little bit different way of thinking, as opposed to just working with one individual person. And so community public health nursing, it's, you're still going to use your skills. You're going to still use that nursing process, right? But you're looking at the community as a whole. What can we do to help? And so there's a variety of things, community health. If anybody ever been to their local health department, that's a good example of a community health, right? The public health, or your what do you call it? The public health, they do like things like STD testing. They also may do some screening tests, educational, outreach programs. There's, depending on the area that you live in or the needs of the individual community is going to determine what their outreach roles are. They also do immunizations. So like one thing, in Virginia, so I went to nursing school when I lived in Virginia. I lived there for 30 years before moving to San Antonio. One of the things that our health department had in Virginia is called the Medical Reserve Corps. All right, and so it's a volunteer. You don't have to be in the medical field in order to volunteer. Of course, they want nurses and doctors and things like that. But in the event of a natural disaster, in the event of an outbreak, okay, they call in the Medical Reserve Corps. So the couple times that I did get called was like during hurricanes where they needed volunteers to go man the shelters. All right. So whether it was at most of our shelters are like in our schools, right? And so we would go and hand out blankets. We would just kind of, any first aid that may need to be done, trying to just keep everybody calm, cool, and collected. Another thing that they do that I volunteered for is I would go into I had two like older adult apartment complexes, or what is the word I'm looking for? Like elderly apartment complexes, which were not assisted living. They were just designed for older adults. And so I would go to each one, I would go once a month and I would do like blood pressure screenings. I would look at, like, if they were diabetic, I would look at their glucose logs, right? Just to see how their blood sugars were running. So there's a variety of different things that public health nurses do or community health nurses do. So again, it's looking at community, it's looking at groups of people. And so, looking at the needs, the concerns of those specific groups of people. We can, there's nursing plans, there's nursing programs that we can implement as community health nurses. We can do health education. So whether, you want to hold a class on, blood pressure management, or if you want to hold a class on stress management techniques. So a lot of it is, looking at what the needs of the community are and then finding ways to address those needs. So there's a lot, there's the role of the community health nurse is, it's large. There's a lot of different things that community health nurses can do in a variety of different settings. It's not just through the health department, but we look at the just different roles. There's parish nursing, and I don't know if anybody has ever heard of parish nurses. But those are nurses that are trained. They do a little bit of extra training, but they work with specific congregations, right? Doesn't matter what church it is. So that's the big difference between, just like med-surg nursing and community nursing. Again, we're going to look at the whole community as a whole. The Healthy People 2030 is really going to help you to look and see what some of the common concerns. Another big thing to really get a handle on is to understand the 3 levels of prevention. And so those 3 levels of prevention, if you remember, are primary, or secondary, and tertiary. So best way I remember primary, secondary, and tertiary. Primary is prevention, secondary is screening, and then tertiary is treatment, right? So kind of just go with the same letter for the first one. So like primary is trying to prevent the onset of disease, right? So whether it is, giving immunizations is one way that we could try to prevent disease, right? It could also be reducing risk factors for disease, right? So if we have somebody that is a smoker, a heavy drinker, right? What are some of those things that we can do to reduce that risk, right? So those are your primary prevention. Secondary, again, that's your screening. So this is early identification, right? That's the best way. So like your pap scans, your prostate exams, your mammograms, screenings, right? Then the earlier we recognize and identify a disease, right, the better chance that we have to, treat it. And then tertiary, right? That is the treatment part of it. And so variety of different things, it could be the actual treatment process. It could even be like your therapies and your rehabs to get back into a, previous level of functioning, or as close to a previous level of functioning as possible.
Hey, excuse me. What time is this over?
It's over now. It's over at 5:40.
Okay, honey, thank
So
you.
I apologize. I'm like right at the limit. But before we go, does anybody have any other questions?
Yes. Is it possible for you to send the resources for next week, like on Fridays, instead of like, like your own personalized PowerPoints or?
I can probably do that, yes.
Thank you.
Absolutely. All right, well, if you guys don't have any other questions,